Hi, my name is Sophia Hopewell, and this is my video on HIV prevention. So to know about HIV prevention, you first have to know about HIV transmission. So we talked briefly about it last time, but essentially there are only 3 ways HIV can get into your body, and these 3 main methods are through unprotected sex, through blood-to-blood transmission, so someone's who's HIV positive, their blood comes into contact with your blood or an open wound, and mother to child, either in utero or during birth or while breastfeeding. These 3 main methods stem from the fluids indoors model, which essentially means there are only specific fluids and specific doors, which are just ways HIV can get into your body. So these fluids are semen, vaginal secretions, preseminal fluid, blood, and breast milk, even though it's less likely for one to get infected with HIV via breast milk. And then there are also only specific doors or ways that these fluids can get into your body that will actually cause an active HIV infection. And these doors are the tip of the penis, the vagina, the anus, and any open wound or ways that HIV could get past your skin barrier, because your skin is effective in preventing a lot of viral diseases, including HIV. So the only way for you to get infected with HIV is for one of these infected fluids to get in a door. So it has to bypass all the protective barriers that our bodies have to actually produce an HIV infection. So for HIV prevention, all we have to do is stop the transmission of HIV. And in order to stop the transmission of HIV, we have to encourage, most importantly, I would say, safe sex. So unprotected sex is one of the main ways that people become infected with HIV. So we try and say to follow the ABCs of HIV prevention. And these ABCs are abstinence, being faithful, and condoms. So abstinence simply means not having sex. It's the only way to make sure that you will not be infected with HIV through sex is to just not have sex at all. It's the only for sure way. That being said, a lot of the times that's an impractical request. So we also have being faithful, which means being open and honest with your partners, disclosing HIV status, making sure not necessarily that it's a monogamous relationship, but that you know the sexual social circle that your partner is in, because I know one of the main phrases is you have sex with everyone your partner has sex with, and this is true in terms of viral transmission. So in terms of HIV prevention, you want to be sure who your partner has sex with and making sure they have safe sex, so that you can protect yourself and them, and knowing your own status and getting tested is one of the biggest ways you can prevent the transmission to other people and help protect yourself. The C part of the ABCs is condoms. So always using condoms, because condoms block the transmission of HIV, and therefore are protective to both you and your partner, or to someone and their partner. There are only specific types of condoms that work, but we won't go into that now. So for higher risk groups, there are also other ways to prevent HIV, including prophylaxis, which is essentially just attacking HIV before it actually produces an active infection. And you can have pre and post exposure prophylaxis. And then we also have drugs to prevent mother-to-child transmission. I believe 72 hours before the birth, the mother can take drugs and it will prevent the transmission of HIV to the baby during birth, and they're extremely effective. And then in addition, the mother would not breastfeed the child, as the child could potentially be able to contract HIV while they're teething and they have open wounds in their mouth, since breast milk is, even though it's very not very potent, it still can infect someone with HIV, especially if they have open wounds in their mouth. And then again, with the blood-to-blood transmission, the safest ways to prevent HIV transmission are not sharing needles and covering up any open wounds, especially if you're working or if someone is working in a hospital or places that they would be exposed to HIV. Those are the most important things about HIV prevention. Thank you.